Hello, my name is Feyza. I currently work in Laboratory of Clinical Chemistry, Untitled Training and Research Hospital, Focus and Endocrinology. I would like to talk about atypical cells in urinalysis. I will start my presentation with definition of atypical malignant cell. Then I will discuss histologic atypia in urine. I will talk about recent technology for detection of atypical malignant cell in urine. Then I will report you about our case. Pathologists use the word atypical cells to describe cells that look abnormal either in shape, color, or size compared to normal healthy cells in the same location. Figure 1 shows example of an atypical cell. As you can see in figure 2, from the point of cytology, neoplastic cells share common features of atypia like high nucleus cytoplasm ratio, enlarged and hyperchromatic nuclei. In addition, the cells might divide or grow. They might also look like a cluster of cells without a boundary. What is urine cytology? A test to look for abnormal cells in urine, urinary tract cancer, most often bladder cancer. Why is it requested? Blood in urine, hematuria, can help detect a recurrence diagnosed with bladder cancer. Advantage, best detect larger and more aggressive urinary tract cancers. Limitation, not detect small urinary tract cancers that grow more slowly. How to interpret atypical, suspicious, or positive? If atypical or cancerous cells are detected, urologists should be contacted. In 2015, Anderlini et al. Presented an inspiring study in which expert pathologists reviewed digital images of specimens in an automated urine analyzer. Can identify the presence of atypical urothelial cells in a clinical laboratory setting and for some subjects may anticipate bladder carcinoma diagnosis. We use the automated urine analyzer for urine analysis in our laboratory. I will talk about the methodology. Cells are counted with the fluorescent flow stomatic methods. Atypical cells show side fluorescence and scatter light properties indicating their enlarged nuclei and increased nucleus cytoplasm ratio. If more investigation of certain particles is requested, automated urine analyzer presents image captured by an internal camera. Instruments of hematology and urinalysis use very similar methodology. The atypical cells in urine bears more problems compared to its counterpart. Firstly, urine is much more an unpredictable medium compared to the whole blood. And secondly, cytological decision of atypical cells in urine is partly a matter of debate in cytology. A decision limit must be defined. Perhaps the color parameter should be matched to define patients with both hematuria and atypical cells. Only an expert in tumor cytology can identify these cases. Ren et al. Suggested that the atypical cell assay may be used as an accessory test for patients with suspected urothelial carcinoma. In the light of this information, if we talk about our case, 83 years old male, admitted to urology outpatient clinic with hematuria, referred the patient to us for routine biochemical and complete urinalysis. We came across the three atypical cell and hemoglobinuria. When we investigated the patient, we found that he was a former lung cancer patient. What did we do towards the patient diagnosis? We set out to flag any atypical cell parameter results higher than an empirical threshold for the research purposes and obtain results for 1,000 samples by that time. Received results for 27 of the parameters studied by the analyzer. Only positive values are given in the table 1. Hemoglobin 3 positive. Acquired digital macroscopic images of the atypical cells research parameter from the analyzer. Evaluated the image manually by visual screening. The analyzer has flagged 1,000 urine samples in 3 months' time as containing atypical cells. These images were in line with the results of the flow cytometry unit besides many atypical cells. Yet, in our visual screening of the images of these samples, we have not detected any occurrence of atypical cells. But in our visual screening of these patients, sample you can see picture 1, we confirmed the presence of true atypical cells. These cells match the definition of atypical cell. We informed the urologist about the presence of atypical cells. Given this information, the urologist decided to conduct a cystoscopy. On cystoscopy, mass lesion was seen, transurethral biopsy was performed. The mass was detected as seen in picture 2. It was reported as a high-grade urothelial carcinoma invading the muscularis propria as shown in figure 3. If we summarize, the patient came with the complaint of hematuria and history of lung cancer treatment. The urologist referred the patient to us for routine biochemical and complete urinalysis. Patient urine was analyzed in the automated urine analyzer and urinalysis test results showed hemoglobinuria and proteinuria. Atypical cells detected in digital microscopic images. We confirmed the presence of true atypical cells, recommended a cystoscopy procedure. Further investigation was conducted with a CT scan of the bladder and urinary tract. And for cancer treatment, surgery, chemotherapy, and radiotherapy planned. What did we learn? This case has shown us that atypical malignant urothelial cells in routine urinary sediment is worth knowing and reporting presence an available novel parameter in a full automated urine analyzer. A decision limit must be defined. Perhaps the color parameter should be matched to define patients with both hematuria and atypical cells. For patients with hematuria, closer monitoring of atypical cells may be life-saving for earlier diagnosis and treatment planning. Only an expert in tumor cytology can identify this case. Thank you.